Hello, my name is Dr. Marisa Baumann. I am a nationally board certified and state licensed chiropractor here in South Jersey. I own a practice called Altum Chiropractic, located in Cherry Hill, New Jersey. I'm here with my little bear friend. Quarantine video problems, but I just want to talk a little bit today. We can't meet at the event. I'm so sorry. I was very excited to do that, but maybe in different times. And so I want to tell you a little bit about what we do as chiropractors, what we look for in our office specifically, and then how that relates to this particular population. So just generally, as you know, your brain controls and coordinates every function in your body through the spinal cord and its nerves. These nerves are like roadways and pathways that allow your brain to send all of those messages throughout your body. But when we experience stress, and that can look like physical stress, chemical stress, emotional stress, even going way back when to the first stress that we all experience, which is the birthing process, this can result in negative effects on the body and cause undue tissue damage, irritation, and inflammation around those nerves because your body has to compensate. This is going to interfere with normal physiology, biochemistry, and the optimal functioning of otherwise healthy tissues. And over time, this may lead to aches, pains, and different dysfunctions and disease processes. But the interesting thing is that did you know that only 20% of nerves are based on feeling? For example, can you feel your pancreas or your spleen or your liver functioning right now? No, typically you cannot. And that's because the 80% or the remaining majority of our nerves are actually based on just general function of our body. Nerves not only control all of our vital organs, but they also go to every muscle and joint in the body, and so we can experience aches, pains, and other musculoskeletal pain and complaints. Now, in our office, we care obviously tremendously about how you're feeling and those symptoms that you're suffering from, but we care a little bit more about how your body is actually functioning, because we know that if you have proper function from having proper structure, then you're going to have proper feeling as a result. And when I say proper structure, your nervous system is comprised of your brain and your spinal cord. And the way that your brain is able to communicate, again, all those messages are through the spinal cord and the nerves. So they're pretty important structures. And so no wonder that they're completely encapsulated for the most part in bone. Your brain is protected by your skull, and your spinal cord is protected by the bones in our back or spinal column. And so when we have that undue stress from misalignments in our back causing that tissue damage, that can result in those aches, pains, and dysfunctions that we just discussed. So in our office, we actually utilize 4 tools so that we can locate where each and every misalignment is that can cause that undue tissue damage and inflammation around those nerves. And that tells us where that brain-body communication isn't matching up. So with that thorough analysis, we're able to administer very gentle and specific chiropractic adjustments, removing that pressure from the nerves and allowing that brain-body communication to be more properly restored. So with time and repetition, that not only leads to short-term symptom relief, but optimal health and the ability for your body to heal from the inside out over time. In traditional chiropractic care, you may be familiar with that or have been told in the past, doctors may use their hands to work on the spine and on different areas of the body to try and realign structure. Instead of directly adjusting muscle and bone in our office, we work and go a little bit deeper and try and work to influence the actual nervous system. You're wondering how we do that. So we actually utilize an instrument in our office to adjust with. It looks like this. And this instrument actually has a lot of really unique features that allows us to get longer lasting results a little bit faster. So first of all, it's the first instrument that was approved by the FDA, which is pretty amazing to be used for vertebral subluxations. So that just goes to show you the science and the research and the energy to get that approval behind it. Secondly, this instrument fires at 1/10,000th of a second. We've all heard of that physics equation, force equals mass times acceleration. So in order to have a big force output, you can either be really heavy-handed or use a lot of mass, or be really, really quick. So this being the fastest instrument that we have out there in the market allows us to be really speedy and really fast while still being very light-handed and obviously feel really gentle, but still produce a big force output in the body. Sorry, I'm trying to hold this camera with my hands, so it might be a little shaky. On top of that, this instrument is 100% reproducible. Now, it's preloaded and it fires at the exact same force and depth every single time. And so rather than me pushing on different areas of the body and adjusting, which is not reproducible because I'm not a robot, this allows us to get that reproducible adjustment, whether you're the first adjustment of the day, the last adjustment of the day, it's the third adjustment that you're getting or the first adjustment that you're getting, since this fires at the exact same force and depth each time. And that's what we want, reproducibility. What this instrument can also do is apply torque. So we know that our bodies and our bones can shift from front to back, side to side, and that's pretty easy for a trained chiropractor to adjust, but the wedges and the rotations can be a little bit more difficult. And so by adding torque to this instrument, we're actually working to eliminate all three components, all of those planes, in just one adjustment. Now, how does this relate to you and or your child or family member or friends that may be dealing with a special needs population? So specifically, I want to talk a little bit about autism spectrum disorder. At my prior offices that we've worked at, we've actually worked with a lot of children of various different health issues and ailments that they're dealing with. And when it comes specifically to ASD, autism spectrum disorder, that really impacts how a child perceives their environment, socializes with others, which can cause issues in important areas like social development, communication, and behavior. Now, the CDC has recently disclosed that about 1 in 68 kids today have been diagnosed with autism spectrum disorder. So it's very prevalent and it's becoming even more common. There's no cure, there's no treatment that works for all children across the board. Everyone is different, every case is different. And so there's various options like behavioral and communication therapy, education therapy, family therapy, antidepressants, antipsychotic drugs. There's other non-medical approaches as well, like sensory-based therapy, specialized diets, chelation therapy for the removal of mercury or other heavy metals in the body, and also even acupuncture. In some select cases, chiropractic adjustments have actually been shown to be extremely helpful in improving language development, effectiveness of other therapies as well in combination when paired together. And so I want to talk about this one study that found that up to 50% of children with autism spectrum disorder under chiropractic care showed behavioral improvement. It's pretty amazing. And such improvement was included and measured, but not limited to, the use of sign language, reduction of self-abuse, and appropriate use of language. If we ask ourselves, where does sensory information become integrated in our bodies? And of course, that's in the brain, part of the nervous. And so by caring for the nervous system, insofar as removing that subluxation or that neurological interference or that miscommunication between the brain and body, our goal is for the individual to be able to better handle that information as it gets processed in the body. So I want to give you another example of a few case studies. So one was actually done by a colleague of mine up in North Jersey. He worked with a 4-year-old nonverbal boy with autism spectrum disorder who was brought in to the chiropractor. After 15 visits, he showed significant improvements in language development, increased sociability, and cognitive improvements. In fact, according to the entrance and exit, I want to get this right, so I'm going to read it, Autism Treatment Evaluation Checklist. His speech and language scores improved by 34.8%, sociability by 50%, and sensory and cognitive awareness by 50%, and health and physical behavior score also improved by 31.4%, which is pretty incredible. In another case, a 10-year-old female presented with neck pain, low back pain, head banging, insomnia, and other uncontrolled behaviors. Upon examination, she was found to have subluxations, and so they were adjusted with the instrument, our technique specifically. After 12 adjustments over an 8-week period, the parents reported her as being more relaxed, having no more unnecessary outbursts, and a calmer demeanor. And they also said that her sleep improved, which is pretty amazing. Another case I have to share with you, we followed the behavior, anxiety, and musculoskeletal pain in a 9-year-old boy with Asperger's syndrome, which is on the spectrum, but not necessarily as severe as autism spectrum disorder, as you know. And he also had anxiety disorder. Now, this individual received chiropractic care for 2 months, and the parents reported improvements in his behavioral challenges and his other musculoskeletal complaints listed on, again, that autism treatment evaluation checklist and on the Promise 25 parent proxy measure, which is just another way to measure progress. So in conclusion, our whole goal is working to empower the body's natural ability to both stimulate and reduce nerve activity in different ways. This allows the body to recover from neurological trauma and subluxation naturally without any unnecessary side effects. So the whole goal is we don't treat the symptoms. We don't treat conditions. We're not medical doctors. What our goal is to work with your nervous system and your body to help improve and give you the opportunity to work at 100% optimal function and expression that your body, your child's body, is meant to have and was born to have. And chiropractic adjustments have been shown to help improve that. So that, to me, and to many other families, parents, children, friends across the world, is a beautiful thing and a beautiful opportunity. If you want to learn more information about what we do specifically in our office, feel free to head to our website, www.altumchiropractic.com. We also have Facebook and Instagram set up. The handles are at Altum Chiropractic. You can feel free to reach out to me anytime. Again, my name is Dr. Marisa Baumann. I have a practice in Short Hills Town Center off Evesham Road in Cherry Hill, kind of the border of Cherry Hill and Voorhees. I'm here for you. I'm here as a resource for you. If you have questions about chiropractic care and how that can relate to not only you or your child, your family or friends, but just questions in general, again, please feel free to reach out to me. I hope that this was educational and informative to you, and I look forward to serving you in the future. Have a great rest of your day and stay safe and healthy. Bye-bye.